All right, let's just get right to it. You're here because you need some straight answers about something called chorionic villus sampling, or CVS, and you probably need them like right now. So consider this your guide.
So I'm guessing I know the scene. The doctor just dropped that term, CVS, and now you're sitting in the car, maybe in the clinic's parking lot, just furiously Googling. It's a moment that can send you into a real tailspin. You hear words like invasive and risk, and your mind just goes to the worst places. I totally get it.
Okay, let's cut through all that noise and panic. This explainer is here to give you the simple facts, what this thing actually is, what the real modern risks are, and maybe most importantly, what your job is through all of this.
So, first things first, what are we even talking about here? You see, unlike a screening test that just gives you probabilities or odds, CVS is what's called a diagnostic test. It's designed to give you a definitive yes or no answer.
Here's the deal in plain English. Sometime between 10 and 13 weeks of the pregnancy, a specialist takes a teeny tiny sample of tissue from the placenta. Now, because the placenta and the baby both grew from the exact same fertilized egg, they share the same genetic blueprint. This is what lets the test be over 99% accurate when checking for specific genetic conditions.
So why would a doctor even bring this up? Well, it usually comes down to a few standard reasons. If your partner's 35 or older, that's a really common one. Or maybe you got a high-risk result from an earlier screening test. Sometimes there's a family history of a specific condition, or a previous pregnancy had a chromosomal issue. The main takeaway here is that it's offered for very specific, very normal medical reasons.
Okay, let's get to the big one, the part that causes pretty much all the anxiety, the risk. This is where so much of the fear comes from, and honestly, a lot of it is based on really old information. We're going to bust some myths right now with actual modern data.
You've probably already seen this number online. A 1 in 100, or 1%, risk of miscarriage. It's a terrifying thing to read, and it's absolutely everywhere. But I need you to look at that number and understand this. That is not the reality anymore. It's old news.
Here's the number that matters today. At a high-volume center with a specialist who does this all the time, the added risk from the procedure itself is as low as 0.22%. That's about 1 in 455. It's a tiny, tiny fraction of that old, scary number. I mean, think about it. The normal background risk of miscarriage at this stage of any pregnancy is already around 1 or 2%. This procedure adds a very small risk on top of that.
So, this becomes your number one mission. The data is crystal clear. The single biggest factor in how safe this procedure is the experience of the person doing it. So you have every right to ask your doctor, how many of these do you do a year? And what is the center's specific loss rate? That's you being an informed partner.
All right, let's talk about the day itself. We're going to cover what the doctors are doing and, just as important, what you're doing, because your role here isn't just to sit in the corner. It's active and it's absolutely essential.
The medical side of things is actually pretty quick and straightforward. First, they do a detailed ultrasound to find the exact perfect spot on the placenta. Then, based on where that is, the doctor decides whether to go through the cervix or the abdomen. It's not really a choice, it just depends on the body's anatomy. And then they take the sample. And listen, this is key. The actual uncomfortable part, the part you're worried about, it lasts for less than 2 minutes.
Okay, now for your playbook. Your job. Number 1, be in the room. Seriously, studies show a partner's presence literally lowers anxiety and how much pain she feels. Number 2, hold her hand. That physical contact is an anchor in a really intense moment. 3, just offer quiet, steady reassurance. Nothing fancy. You're doing great, I'm right here with you. And finally, just be her calm. She's going to feed off of your steady energy. You are her rock in that room.
Once the procedure is over, you enter what a lot of couples say is actually the hardest part, the wait for the results. It can be a time of just intense anxiety, but you can get through it if you have a plan.
So the results come in 2 ways. First, in just 2 or 3 days, you get the preliminary results. These check for the most common issues, and for the vast majority of couples, these results bring a huge, immediate wave of relief. Then, about 10 to 14 days later, you get the final, full, comprehensive report. So, how do you get through that waiting period? First, just acknowledge the feeling. The worst thing you can say is, don't worry. Instead, try, I know this is tough, I'm worried too. We're in this together. Second, keep busy. Plan stuff, work on a project, anything to redirect that nervous energy. Third, make a pact with each other. No late-night Googling of worst-case scenarios. Just don't. And finally, have 1 or 2 trusted friends you can lean on.
Now, you might also hear about another diagnostic test called amniocentesis and wonder which one is better. The truth is, neither is better. It's just a trade-off, and it depends on what's most important to you as a couple.
Look, the main difference really just boils down to timing. CVS happens much earlier, in the first trimester, which means you get answers sooner. Amnio happens later, in the second trimester, but it has one extra advantage. It can also detect neural tube defects, like spina bifida, which CVS can't. In today's world, their safety risks are very, very similar.
So what's the whole point of this? What's the bottom line? It's about the power of certainty. Pregnancy is just filled with so many unknowns and so much waiting. CVS is a tool that lets you replace probability and worry with a definite answer, and it does it early.
And it is so important to remember this. The overwhelming majority of couples who go through with CVS get normal results and feel a profound sense of relief. But no matter what the outcome is, your job stays the same. Being that informed, steady, supportive partner, that is the most important thing you can possibly do.
At the end of the day, you're not just a bystander here. You're not just the guy driving to the appointment. You are a crucial player in this whole process. So the only real question left is, are you ready to be her informed, steady, and truly indispensable partner? You've got this.